That's what I'm wondering. What's going on? Adi? Disconnect toka YouTube kabisa. Itaanza kupiga tu kelele tena hapo sasa hivi. Dr. Ayemba, unanisikia?
Hi.
Hi.
Nakusikia vizuri.
Fantastic. Masika?
Hi, sir. How are you?
Good, good. Uko poa?
I'm good, and you?
Brilliant, brilliant. Ayemba, unaweza kasimu landscape?
Okay. That's better. Let me see. Now I can't see myself. Is that better?
Auto rotate the other way around. Auto rotate too.
Eva? That way, this way.
Can you unaweza activate auto rotate on your phone?
Okay. Auto rotate, all right.
Then tuone vile itakaa. Yes,
Evo?
there. Evo.
Great.
Evo. Now
Okay.
keep it like that.
Okay, cool.
We're about to start right now. We'll go back around 7:15. Mwesh, how are you? Great. This is a very tricky subject, so I will not be prying. I will just give general questions in respect. Okay. So when I'll ask you things like how are you doing, yeah. When I ask you things like how are you holding up, I will just need you to explain as far as you're comfortable with, and then we'll just see from there. Liz is a psychologist, and Moses Masika is a virologist. You'll bring very different aspects. Liz will be talking about the psychological impact. Masika will be talking about the vaccine and the virus and why is this more vicious now, things like that. So they're more the medical side, you're more the human direct side. That is a good question for Masika. All right, thank you for staying with Daybreak. We'd like to hear your views on this issue. We're talking about the COVID-19 pain. Families are struggling to come to terms with COVID-19 deaths. We've seen distance created between COVID-19 patients and families. How is that affecting the people? With me in studio, people who've gone through it as well. So we'll be very respectful on this conversation, but just to find out how they're feeling. And also Liz Ayemba, who's a psychologist, will be giving us the psychological impact of a disease. Most of the time when people are going through diseases, they come together. This is a disease that forces you to be away from your loved ones. What does that impact you as a person? Moses Masika is a virologist and also a lecturer at the University of Nairobi. Is also joining us to give us the technical aspects of it. Is the third wave more vicious this time? We'll find out from him. And joining me in studio is Honorable Gladwell Cheruiyot, Women Rep Baringo. Thank you so much for making time. Honorable Cheruiyot, I'll start with you. How are you holding up this far? How are you doing?
We're trying.
Yeah.
Yes.
This must have been a really tragic event for you. Did you understand what you're dealing with during the time?
Not really, but you see, there's no dignified death. Loss is a loss. It doesn't matter how you lose it. So for those of us who lost through COVID, those who lost through accidents and any other things, the feeling is the same. And it's not an easy undergoing an experience. I must say, and by the time this was happening, the disease was still very strange, and the protocols which were kept were very unfriendly, and it leaves you in a very lonely situation and very sad. Yeah.
When this was happening, it was during the first phase. There was not much information about it. So what comes to your mind when you hear the people saying that this is not even real?
I think those who are saying it's not real, they aren't also real. Because if we have people who have lost people through it, then you're still saying it's not real, then probably you're waiting to have it so that you know it's real. But like you're putting it, the first wave that took our beloved ones was very strange. The protocols were very tough, and I'm one of the people who really felt very, very bad about how the disease was actually described and how the health protocols, WHO and even in the ministry were given, and it was so torturing. Because one, you are not supposed to interview the body. Of course, for me, I was a bit lucky because I was given the respect to do so. But many families, they weren't even be able to see their loved ones. Some people, they were burying at night. Not even burying, they were somehow being thrown away. And I want to believe so many families have never come to terms. Because even the type of the burial was very, very unfriendly. If you want to figure out, like for me, I've never even looked at the video I took that time. I don't want to see it. Because you are wondering whether you did justice to the departed. But again, we need the scientists who are before us today to actually give us some explanation, because I'm also a medic. I might not be a doctor or a virologist, but I was always asking myself, a body in a casket, how can it be more infectious than the living person? Because it seems they were making people to get so scared about a body which is immortal, and unless you go near, you go touch it, it cannot. But the people who are within you, even if they were saying 50 or 100, one of them could be having it and cannot. We were getting, you make people fear the dead more than the living, who can really infect. So I don't know how they came about this. And you are done like that, and after that you're left with a lot of psychological torture. And by that time again, the disease was made to look like a disease of shame. It was, the rumor around was very paining. It's like, it was even more than STDs. It was more than HIV. Whereas this is a disease you don't choose to get. And you don't know even when you are getting. So I think there was, to me, there was a misconception on how the information reached the public. And that is why it took long for people to even come to terms with the disease.
Yeah.
So I think it gave us a lot of stigma. It gave people a lot of stigma then,
Yeah.
such that it was even not very easy to get someone to conduct the service for the burial.
Yeah.
People were running away literally because of how the awareness was made.
Okay.
And I want to believe the families that have gone through this are still having a lot of psychological challenges.
Yeah.
Mental health is a real issue in this disease, especially the first phase and even the second phase.
Yeah.
And so, at least for the third phase, probably people are coming to terms and the protocols have been kept to be lighter a bit than before. And some burial dignities have been kept so that families, because if you scare people using the deceased person, then you are leaving the living people almost the deceased also because they are sick mentally.
Yeah.
Yeah.
Masika, let me bring you in on this, and what Honorable Cheriot is explaining is something very pertinent. Was it really necessary to take the burial protocols that were taken by the government in hindsight?
Thank you, Trevor. I would like to pass my condolences to Honorable Cheriot, and I think states that I'm glad she's able to come out this boldly despite the loss that is certainly paining her. And she has highlighted the key issue we had in the early were put in place in good faith, but the implementation was exaggerated, and we certainly did not treat our department. And for sure, we can try and explain this in many ways, but I think the bottom line is that we should have treated them better, and these families probably require more support, especially psychological care to manage how that went down. The other, of course, there are some reasons, especially on the lack of information and the need to protect the living, but also the fact that the people implementing these protocols went overboard to try and do that, and this showed a lot of either lack of recognition of the cultures that we have around such ceremonies, or even the need that people have to say goodbye to their departed ones. So for that reason, I think we cannot create anything, and we need to deal with that that we created that.
All right. Liz, what is the psychological impact of dealing with sudden death and dealing with protocols that are very foreign?
The psychological impact of dealing with sudden death. Of course, sudden death or death within a very short period is usually very shocking for the family, the community, the country as a whole, and this is what we have seen with COVID. There's been not much preparation. We've seen that with COVID-19, one falls ill and dies within a week even, or a few days, or even suddenly without any. So there is the shock, and of course the process of grief starts immediately. Or with COVID, I found actually the process of grief starts even before death, even before diagnosis. And for many, many Kenyans, we will kind of admit that we are all going through the process of grief. So when we face a situation where somebody dies over a really short period, and my condolences to Honorable Cheriot about this, we have a very intense grief, and sometimes even this grief that is not natural, which is what a lot of the country right now and a lot of the individuals who have lost loved ones are going through, where they did not have there was a lack of power, a lack of control, a lack of basically the helplessness is quite apparent among even people who could probably have afforded care had it been a different kind of illness.
Yeah, but Liz, you know, there's also this issue of what does it do to the family? Because whenever we are faced with adversities or even a disease, that is a time for people to come together. But here's a disease that has been described by many people as a lonely disease, that people want you to stay away from your loved ones. What kind of an impact does that have on the general family itself? Isn't that what then creates the stigma that this is a disease of shame, like what Honorable Cheruiyot was saying?
Yes, it is. That's true. But you see, with COVID, what has happened so far is we all suffer from fear of the unknown. And fear of the unknown is one of the main things that actually causes stigma. And when one falls ill within a family, the natural instinct is for us to want to protect that person, say a husband or a child. We want to protect that person, we want to come together and just be with that person. But because of the protocols and because of the nature of COVID, we are actually told to stay apart. So there is incongruence basically within individuals in the family where they want to be together but they can't. And they are forced to be apart. And then there is the fear that then will cause the stigma even within the family itself, where a child is afraid of a parent, where a parent, a couple is afraid of the other, and we really don't know what to do. That is actually foundation for major mental health issues, I would say.
Okay. Masika, is this third wave, is the virus more vicious now because we seem to be seeing an increase in deaths? Is this natural for viruses to mutate and become more vicious, or what is going on?
Trevor, if you look at the proportion of people that is dying, the number of people, say, out of 100 that is dying is similar to what we've seen before. So what we're seeing is an increase in the number of cases that are being reported every day. And this is consistent with the pattern we've seen in the past and elsewhere, where when we drop our guard in following the prevention measures, when we drop that, we end up getting an increase in the number of cases, and this has been increasing gradually. So I wouldn't say the virus is more vicious. I would say it is spreading quite fast, and now it has reached that level in the community transmission where really you can get it from anyone and anywhere, where it was during the previous 2 waves. So it's not like the current wave is causing proportionately more deaths. It's similar to what we've seen before, really, largely, but we are seeing an increase. In my view, in the number of cases, in my view, it's mainly because we dropped our guard and stopped following the measures as strictly as we had done in December and I think late last year, August, after the second wave in August. So until we follow our prevention measures much more carefully, we are likely to see such surges.
Yeah. Honorable Cheruiyot, you know, for me, you are in government right now, and you mentioned that the impact that had on you was quite high. Do you think, what kind of recourse should be taken at this particular point for those who suffered that kind of loss and that kind of humiliation at a point when there was not much information coming through?
I think the government has something to say about this, and even apologize to the families for how information went out, how awareness was made, the stigmatization, the treatment of their loved ones who are departed. I don't know whether this was happening only in Kenya or around the world, the way the bodies were disposed. But I tend to think if they are not in a position to really come to tell Kenyans that they went overboard, then the other thing they need to do is to reach out to such families through psychology counseling. Because mental health is real. Sometimes somebody can stay and you think they are okay, but within the time that they are themselves, they are within themselves, they are staying by themselves, they undergo a lot mentally because they can't come to terms. You see, they say time heals. And you remember, some of us are not Muslims. Muslims are used to, when somebody passes on like this morning, by 1 they are buried, and they're okay with that, and they know how else they are going to really stay together, mourn until they are okay. But for us, we were taken to a very strange thing where somebody passes, and they pass, you know, somebody passes without actually even you noticing that he was to go. Like my husband was only in hospital for 2 nights. And that was it. And we were chatting, and all of a sudden he was not chatting. And so that is it. So if somebody passes on and it is so sudden, then you are told to bury so suddenly. And you know, in our culture or in our religion, we don't know how else to handle it. And you have no friends around. And everybody is leaving you there. And so after the person, you are left with the grave. People have left. The few who are with you, your relatives. So we don't know how to go about it. Because again, still, people look at you as the affected person, as if you are also sick. And they get scared that you might also infect them. Even despite the fact that you have tested negative, it was not easy to say. And being a leader at the same time, and losing your spouse to such a disease, at the time it was termed as shame. It was very terrible. So I'm thinking, and you saw that, and you see the time of illness, because I don't know, I cannot tell how this disease took him away. I can't tell. In fact, I must say, because I'm in Citizen TV, I also had news from Citizen TV. You broke it before I knew. Yes. In fact, it was so bad, and at some point I thought of suing Citizen TV. But I said, because, you know, the information went, I saw it on the screen.
I am gutted by that. I'm deeply sorry for that. That should not have happened like that.
Yes. And I know it is because I'm a politician.
Yes.
And you know, sometimes politicians, we are treated like we don't have feelings. It is a public information. But there's this family feeling. So to me, we need to really reach out, especially families that were affected at the first phase. Because when children they have not come to terms. Even my own children, they have never come to terms to this moment, because, you know, you have not been told your father has been sick. Then all of a sudden, your father has gone. Then all of a sudden, your father has been buried. Then that is it, you are fatherless. So I think we need some mental health, psychological counseling to the people that were really affected or that are affected. And we are glad that at least the ministry, the protocols are better now. People are given time to really mourn their loved ones within a certain period, which is reasonable. And even at the burial, at least you are given, a service is even conducted. You know, with our case, there was no even service conducted. You just bring the body straight to the grave. And then that's it. So to me, the psychologist who is speaking there, if we really have a department for psychology in the government, it's good to visit these families to see how people are going, because still, this disease leaves the country still sick. Because if I'm mentally disturbed, you are sure production can be low. For some people, not everyone can really come to terms. And it takes quite some time. I can tell you, even me, I have not come to terms. It is still so fresh. And even when I was called to come here, I really took a lot of courage and said, it is only I and other leaders who are able, who can come and really try and share. This is me as a leader. And maybe probably I was treated a bit more better. I'm just trying to wonder what could be going on with the psychology or mental health of the common mwananchi who might have been treated more roughly than me. What could be happening? Like the families we saw, where bodies were being thrown, some evacuated to be reburied, and so forth and so forth. And so you are just asking yourself, so how is this family at the moment? Because it doesn't matter what takes away your loved person. It doesn't matter what takes away. The fact remains, this is a person. You go through, the person dies through HIV, you die through corona, that's HIV, COVID-19, or any other. The feeling is the same. You have lost someone. To some people, it is like, what happened to Mheshimiwa so-and-so? You mean her husband? In fact, some people are even saying, we don't believe. You know, this is unfortunate for women, and especially being a leader. When something happens to your spouse, the first that comes out is, ay, apana. It's like she neglected her. Some are saying, oh, she killed, you know, many things. And without wanting to know what you really feel. So I can tell you it is a bad feeling. It doesn't mean people don't die. Yes, they do. But the way people are handled at that period of time. And you see the way those public health officers were dressing, like they want to go to the moon. You alight from the vehicle, they spray, they're almost spraying even you on your face. You are now wondering, humanity was not kept at all. So, and these are the things when people saw, they get more scared and they get more stigmatized. That is why at that time, even up to today, some people cannot say, I have COVID. Even up to today. When we hear, because we have even people we know right now who are suffering from it, they are in hospital, they could be friends, they could be relatives. But how many people come out and say, hey, look, so-and-so is in hospital, he's sick, he has COVID. Or who can come out and say, please don't come near me, I'm COVID positive. The stigma is still there. And as long as we don't deal with the stigma, the infection rate will continue. Because when I expose my status, it is the time that you can take care of yourself and I can keep more safety. But now because we want to hide, the stigma is there. For HIV to start going down, it is when we started dealing with the stigma. That is when now people exposed and say, I'm HIV positive and I'm living positively. For COVID, it's not a sexually transmitted disease. And even if it were, there's no need for stigma. And so I think the Ministry of Health has a lot to work on to remove this stigma that is there, which has even been projected to the vaccine. The stigma of the disease itself has been projected to the vaccine that is supposed to give protection. And so we have a challenge.
Honorable Cheruiyot, I am deeply sorry that you had to find out like that. On behalf of the entire All Media Services family, I apologize to you that you had to find out on TV that your husband had passed on. We do not intend to cause any pain here, and I am deeply gutted that is how you found out. So I sincerely apologize on behalf of the entire All Media Services family. On that case, we have to take a quick break. Then we'll come back. We'll take closing remarks on this conversation on vaccines and also on COVID-19. We're talking about the pain that people faced at a time when there was very little information coming through. See you in a bit. right, thank you so much for staying with Citizen TV. This is a very difficult conversation to have. We're talking about the pain caused by COVID-19 at a time when people did not understand what was going on, and even now there's still a bit of stigma going on. And Dr. Masika is still with me. Moses Masika is a virologist and also a lecturer. Liz Hayemba, psychologist, is with me. Honorable Gladwell Cheruyot, also Women Rep Baringo, is with me. Masika, we are seeing a situation now where there's a bit of hesitancy when it comes to vaccinations, which was touted as our solution to this. Why is that happening? Is it the same reason in terms of not communicating the way we were supposed to when COVID-19 struck?
Hesitancy is not new. For vaccines, we've seen different levels of hesitancy, especially when you're beginning to even vaccinate a population that is not used to receiving vaccinations, and in our case, the adult population hasn't. Most of us receive most of our childhood vaccines without problems. Actually, our mothers take us there without lots of ado. But in adults, because vaccinations are not commonly done, we tend to see different levels of hesitancy. And this is not in Kenya, it's across the globe, and that has been observed. The best way to deal with it is to give as much information as possible. And I think so, the initiated ministry and also such try and give the public the right information, because we know of this information and misinformation circulating in the social media especially. And so, some people will not take the vaccine at all. That's a small proportion. There's another group that is waiting for the right information so that they can take it, and they can take the vaccine, and then there are, of course, those who are supporting the vaccine. So this is not unexpected, but it's something we have to deal with.
Liz? Why is this happening right now, psychologically speaking? Because I know there's some level of cognitive dissonance, so to speak. People are wondering, is this the solution? Is it not? Should we do it? Should we not? Should we see our leaders do it fast?
Yes, there is a lot of cognitive dissonance. There is also quite a bit of wait and see. Let's see what happens to the people who take it fast. There have, of course, been reports of some effects, as happens with virtually every vaccine, where you get a few mild symptoms. But there's still a lot of fear and anxiety around COVID-19. So it just follows that this will also be present where the vaccine is concerned.
Yeah. Masika, do you think we should put on hold the use of the Oxford AstraZeneca vaccine?
Not at all, Trevor. I do not know what reason you would have for that.
Why not? Because other countries, more than 11 countries, have suspended it.
Well, the story behind the suspensions was the reporting of clots in Europe. And the truth is that they paused so that they could gather more information on the people who had suffered those clots. I would like to just inform the public that generally in Europe, actually, every year, 1 out of 1,000 people will suffer from clots. So if they do that after getting the vaccine, it's most likely coincidental, but it has to be investigated. So they stopped to investigate, and some of them have actually restarted it. Yeah. And still to date, AstraZeneca is the given across most countries, not most, but the largest number of countries across the world, there are about 80 of them. So I would say if that is the argument, we should continue collecting information for us. And if we see any reason from the information we are collecting to stop, well and good. But so far, we haven't seen anything. Yeah. Most of the effects might not have any serious side effects. And those minor side effects are known and actually expected in a small part of the recipients of this vaccine. So no, I wouldn't support stoppage at this point. Yeah. I know the vaccine is safe, and the minor side effects are outweighed by the benefit of the vaccine.
So at this point, what should the medical experts wait for? Should we brace for herd immunity or hasten the inoculation process?
I would go for making the inoculation process as fast as we can. So we get as many doses within the shortest time possible and administer it to as many people as possible. As we continue keeping the other measures, because these two work in complementary manner.
Okay. Liz, as we wind up on this, so what do we do from here? And Mheshimiwa had asked this question earlier on in terms of the psychological support. How can this be channeled better to ensure that everyone gets some level of support?
Well, I'm glad Mheshimiwa mentioned about the ministry and the work that the Ministry of Health has. I am not a spokesperson for the Ministry of Health, but I have worked closely with the ministry. And one thing that together we have formed is mental health. The ministry is working with organizations like Red Cross, who actually have a call center and a call line where the public is free to call at any particular point, whether it's about COVID, whether it's about fear, whether it's about depression. This line is open to the public and quite available. What we have done as healthcare workers is we have come together, different associations, including Clinical Psychologists Association of Kenya, Kenya Medical Association, Clinical Officers Association of Kenya, National Nurses Association. And what we did is we actually came together to support the healthcare workers. I remember, I hope you remember, there is a time when healthcare workers were dying in quite a big number. And so we created also a call center for the healthcare workers where they can call in at any time. The call center is open 16 hours a day. And the numbers are available and the calls are free, just like they are with Red Cross. And I do believe that from a mental health perspective, yes, the government should actually work harder and reach out to not only those who have lost loved ones, but also those who are ill themselves, those who are, for example, in quarantine, in hospitals, so that we actually provide mental health support throughout. And even for those who are just working, like Trevor, you and I, Daktari, Mheshimiwa, who are going about their daily lives as best as we know, we are all suffering some very high levels of anxiety and fear. We need to actually have some options for mental health support from this. And I'm sure the government is working hard on that too.
Okay. Mheshimiwa, I'll give you the final say on this and on two issues. One, that issue of psychological support. How do we ensure that is around for most people from the legislative angle? And also, you're seeing some level of relaxation. What would be your message to the Kenyans now who are a bit relaxed? They're relaxing these measures. Some of them don't even wear masks.
Okay, I want to really, first of all, continue to condole the family, my family and friends and my children, because even when they are looking at me, I'm sure they are getting emotive a bit. And the people of Baringo also, who lost a husband to their leader. And also to say that it is true. What's happening down there, especially at the rural areas, people have neglected use of masks completely. And even the protocols, washing of hands and so forth. It is very unfortunate. And I'm encouraging, and we are going, I think we need to really go back and talk to our people. Yeah. Because the disease is now back in the villages. At least you can hear someone is sick, someone passed on. Yeah. It means it is dangerously crawling down to the villages. So we want to encourage the members of the public, please take it serious. Please don't ignore this disease. The third wave is even worse. And because time is not on our side, I expected the virologists to actually talk about the thoughts that we are hearing every day about change of strand and so forth, the new way the disease is presenting itself, so that at least people can be aware. But it's unfortunate that he's leaving.
You can still tell us he's still with us. So
yes, because actually that is what we need to hear. Is it true that the disease is camouflaging, it's changing the way it's appearing, so that people can actually cope up with the new feelings and signs and symptoms? Okay. And because when you go back to him, I might close, is that we still also want to continue condoling with the people of Tanzania who lost their president through this disease also. We must know that it's not just a president, it's somebody's husband, somebody's wife, father, somebody's relative and friends, and also the president of Tanzania. Like I saw them, they are really in pain, and we want to really condole with them as a person, and my family, and the people of Baringo County. We pass our condolences, and also want to appreciate what they are doing as a country. It wasn't normal for them to accept the vice president to take up, being a woman, to take up as the next president.
Yeah.
For that one, I really applaud them, and it is a big sign of democracy and appreciation of gender in East Africa.
Okay.
And as a woman, I'm really grateful for that country and the people who made such a decision. And we wish well the incoming president, the Vice President Samia Suluhu, and we want to pray that he will take that country to the next level.
All right.
Yeah.
Moses, there was a question from Mheshimiwa in terms of the new virus. Is it, how is it behaving now? Is it giving different symptoms?
Thanks, Trevor. The new, whatever is circulating in Kenya is hard to characterize because we have not done the deep sequence, the deep analysis that we need to know which variant.
Okay.
That said, we know there are variants that could be spreading faster, but we know that most of them are presenting with the same symptoms that others have presented with.
Okay.
But I think for me, Trevor, the key message from today's session is what Mheshimiwa has said. We need to take care of the psychological needs of these families that she has highlighted so strongly. And I would like to really thank her for coming out so boldly to talk about this sensitive issue. So I think for me, that is the key message in today's session.
All right. Thank you so much. That's Moses Masika, virologist and a lecturer at the University of Nairobi. Liza Emba, psychologist, and Honorable Gladwell Cheruyot, Women Rep Baringo. Thank you for having the courage to come and share this with us, Mheshimiwa. And once again, I apologize for all the pain that you went through. Pass this to your family as well. Tell them we here at the Royal Media Services family do not in any way wish to cause any pain. I am deeply sorry that you had to find out from us here without being informed first. That is a sincere apology from us. Taking a quick break here. When we come back, we'll take a stock take of what's going on at the Machakos senatorial by-election, and then we talk about forests and lives. The CCF, the Chief Conservator of Forests, that's Julius Kamau, is already here with us in studio. So the world is marking the International Day of Forests on the 21st of March. That's on Sunday. That's why we're having this conversation on Friday. All right, see you in a bit.